Milan, the President of International Agency for Prevention of Blindness, ladies and gentlemen, leaders of the health sector, and my friends from media, electronic media and print media. It is indeed a matter of great happiness and an opportunity for me to be here for the 20th anniversary of LV Prasad Institute, ICARE Institute. They have been working for the last 20 years, and as Puno Khetrapal Singh ji talked about LV Prasad Institute, that they have done a wonderful job for the outreach program and making the health facility, especially eye care, to reach the doorstep. And not only that, they have also worked hard for the capacity building as far as the manpower is concerned, as far as the strengthening of the systems are concerned. And they have really done a very good job in serving the humanity and especially addressing the issue related to eye problem. We all know that in our country, nearly 80% of the eye problem is curable. 80% of the blindness is curable. Only what we need is an aggressive strategy and a will to address them. And I find that LV Prasad Institute and GP Eye Care is going forward in that direction. And I found to be privileged to be associated with such institute when it is celebrating its 20th year. As far as the Government of India is concerned, we have taken many initiatives and policy changes to see to it that how do we address health issues. When we came out with the policy of 2017 health policy, many issues were there. One issue was there for comprehensive health care. The another issue which we tried to address was mainstreaming of all pathies. But a very important issue, which always is many times criticized or taken with a pinch of salt, was that when we said that we will go for a strategic engagement of the private sector. This is itself a very path-breaking as far as the policy and programs of the health ministry is concerned, because we believe that individual or an institution, and especially government only alone, is not the repository of wisdom only. We have to take all people into account, their experiences, their working experiences, and their capacities also has to be accumulated together and mainstreamed to work together. And private sector is a sector which is addressing a good percentage of healthcare, and so we have to go for a strategic engagement of private sector. We also try to see to it that the national program for control of blindness needs financial support. So it cannot be a lip service only, it has to be financially supported. So we tried to enhance the support from the Government of India for cataract surgeries, for refractive interventions, for other interventions. And now we are trying to see to it that the payments should also be done timely, so that it becomes an effective program. And that is how we are working. But with this new policy, I must say that our Prime Minister, Hon'ble Shri Narendra Modi ji, our dynamic Prime Minister, has taken a very bold initiative as far as health sector is concerned and health initiatives are concerned. And that is going to bring a change. It's a paradigm shift. And it is a shift which we have to understand. When we say Ayushman Bharat, we all know Ayushman means long live. So Ayushman Bharat means people of India, they should live long, and the life of the nation should also have a lifelong. So it's an Ayushman Bharat. It has got two components, two pillars. Number one is preventive and promotive health care. Till date, we have tried to do it, but we have not been able to address at the primary level the amount of focus which we needed. And the another is secondary and tertiary healthcare, which has to be addressed. As far as the primary concern is, primary health issue is to be addressed, the government of India has decided to convert all our sub-centers and our wellness centers, sub-centers and the PHCs into wellness centers. And this number is 100,000. So that means 1,50,000. These sub-centers and PHCs are to be converted into wellness centers. Now what we are going to do is, and here we need the support of LV Prasad Eye Institute also, is that we are going to convert, where this year, last year we converted 4,000 sub-centers, this year we are converting 15,000 centers, next year we will be converting 30,000 centers, next year 40,000, plus 40,000, this is how by 2022 we will be converting all sub-centers into wellness centers. And we will have a compulsory screening of every person at the age of 30 for hypertension, for diabetes, for tuberculosis, for leprosy, for geriatric health care, for the complications which they develop, for dental health care, and for cervix cancer for ladies, for breast cancer for ladies, and oral cancer for all men and women. And also we want to include in this is the mental health care, the dementia and the Alzheimer part, and also the eye testing centers which has to be introduced in the screening of eyes. This is a paradigm shift in health sector, because when at the age of 30, you screen the people across the country, all the individuals, naturally in coming times will reduce the disease burden. And this is how we are trying to work. And this, your outreach program, your capacity building, your inputs is going to help us in a long way. And we support your cause, and we automatically understand that you are supporting our cause. And so this is how we have to work and go forward in that direction. That is what I would like to say. The another program, which includes eye surgeries also, is the Ayushman Bharat, which is Pradhan Mantri Jan Arogya Yojana, PMJ, Pradhan Mantri Jan Arogya Yojana. This is going to be launched on this 23rd of September from Ranchi, Jharkhand. And it will be across all states. We have 29 states who have done MOU with us. And with those states, we are going to have the marginal sections of the society who come under the socio-economic caste census. They are 10 crore 74 lakh people. And approximately families, 10 crore 74 lakh families, which comes to approximately 55 crore people. We will be giving them a golden card. First of all, there will be a letter with a separate QR code for every individual, and from that they will be getting a golden card which will give them the strength of spending 5 lakh rupees on health coverage for tertiary and secondary health care per year, per family. This is how we are going to go forward. It's going to be the world's largest universal health coverage program. The number which I said 55 crores comes to the whole population of America, the whole population of Canada, the whole population of Mexico, all together, and little less than Europe separately. That much we are going to take care in the universal health coverage, which starts on 23rd of September. So this is the paradigm shift now. And who are there? People, servants who are working in your home, drivers, rickshaw pullers, rag pickers, marginal section of the society, those who have been left out. When they will have the capacity to spend 5 lakh rupees per year for their family, I think it is going to bring a change in the health sector as far as the tertiary and secondary health care is concerned. And this includes eye surgeries also. There are 1,350 packages and 1,350 procedures which are included in it. And for that, which includes the eye surgeries also, all high-end surgeries are included into it. So when they will be also included, I feel that, of course, with your support, we'll be able to, we'll be coming forward to help the humanity and help the people of our country as far as the health sector is concerned. I need your support, and I can assure you, LV Prasad Institute has done a very good job. It is best explained in the film itself, nothing more to be said. But yes, I can say that the Government of India has a very positive direction as far as coming together and working together, how we can work together more for the people of the country. That is what we have to say. One request from my side, that you have now restricted yourself only to Andhra Pradesh, Telangana and Orissa. Your capacity is now to go for pan-India, and that you should develop. I am there to take care of you. Hand holding can be done by me. That is what I'd like to say. Thank you very much for giving me patience.